In this episode of Carpe Diem.
On this episode of Carpe Diem, 3.5 million Canadians live without basic prescription drug insurance. Universal Pharmacare. Is it possible?
Carpe Diem. Seizing the day for Canadians as we age.
Welcome. Over 6% of CARP members do not fill their prescriptions because of cost. On this show, we discuss Pharmacare for all, but especially Canadian seniors. But first, let's meet this week's Zippy Zoomer.
And we're back here with our Zippy Zoomer. We're in Vancouver this week with Kathy. She's a photographer extraordinaire with 10% vision.
Let's see who takes the better pictures, Leah.
Oh, challenge accepted.
It's a full-time job just to operate through life with the little bit of sight I have. I kind of channel that concentration into the photography. I always use the eyepiece. I don't use the screen. I can concentrate everything I'm seeing into that one little area instead of looking at a larger area like that. You know, I can fake it fairly well until I don't. Yeah. I've been doing some stand-up just because it's one of the things on my bucket list I said I would do after.
You know what? We've got to find some people. You should tell them a couple jokes. We're going to do that, yeah.
I've been thinking of some new jokes for my stand-up, and I can't tell you how many times I've asked directions from mannequins. You know, I thought it made perfect sense to bring my monocular to the strip club.
So she's willing to try new things and that sort of thing.
Definitely willing to try new things. Whenever I see what she's up to, I'm like, oh my God, my life is so boring. Yes, I feel that
get
all
it.
right back there.
I get it.
Yeah, so we'll do about 8 of those.
I am invincible.
At least 7 years ago, I knew her first on Twitter.
Oh, wow. So that's how you got to know each other, from social media.
I've been in the PR profession for over 40 years. And for me, social media was just another tool. When I started out in the business, there were no computers. There was no fax, there was no voicemail. I turned 64 on the 7th of March.
Wow.
You gotta play that Beatles song over and over now. Will you still need me?
Will you still feed me when I'm 64? Oh, on that note, we're going to head back to the studio with Carmen. In the meantime, you're going to continue to take those photos there. But if you have a Zoomer to nominate, don't forget to contact us at zippyzoomer@carp.ca.
What an inspiration. Before we discuss Pharmacare, I want to go around the panel and ask you about staying zippy as we age. Wanda, why don't we start with you?
I was so inspired by Kathy, and I think what she illustrates so clearly is that it's not about your physical limitations. And I see this in so many of the members that I meet. You know, as we're aging, we're getting more physically infirm, losing some of our mobility, our eyesight, our hearing, and it's about having the gumption to get up and deal with it anyways. And also, you know, in her case, dealing with the technology and welcoming the assist that can come from using those great aids.
Yeah, I thought it was great too that she just did so many different things, whether it's the photography or the exercise or, you know, just getting out there and being engaged and involved and overcoming limitations and just living life. I thought that was fantastic.
Some Canadians are being forced to choose between paying for their bills or their medicines. All this and more when we come back.
Coming up on Carpe Diem.
I have had cancer 3 times, and this is the medication that I'm supposed to be taking, and I can't afford some of it.
Carpe Diem. Seizing the day for Canadians as we age.
We're talking Pharmacare. What is it? Why do we need it? Let's see the reality for some Canadian seniors who need expensive medicines. Darren Maharaj of Zoomer News caught up with Alison Lakey in Toronto, who struggles to pay for her medication.
Our first contestant He is hungry. He is ill. He has to make a crucial decision. He has to decide food or medicine.
As you can see in that CARP commercial, many Canadians across the country have difficult decisions to make every day when it comes to making ends meet.
My pension that I should be getting by the end of this month would be $347.12. This is the letter that I wrote to Premier Wynne. I have had to decide to pay my bills, hydro and gas, or cut down on a food intake. Also, many times I have to decide on replenishing my medication or not. As of today, I need more insulin. Your help will be greatly appreciated.
And what's been the response from Premier Wynne?
I have received no response as yet.
Nothing.
Nothing. We have cut down on our meals that we have. I would make a pot of soup that would last for 2 days. We can't afford the living expenses, so we're going to have to sell our home.
The situation today, seniors may just as well lie down and die.
I have had cancer 3 times, and this is the medication that I'm supposed to be taking, and I can't afford some of them. I can't afford to buy them all.
Will you talk to your doctor about this?
Yes.
What does the doctor say?
He says if you don't take your medication, you're going to die. So I guess I'm going to die.
Here in Burlington, I'm Darren Maharaj for Zoomer News.
Wow, choose between bills and medicine. Steve, you're an expert on Pharmacare. In a nutshell, what is it?
You know, what Pharmacare really is making sure that our Canadian Medicare system includes universal coverage of prescription drugs that Canadians would need. Every comparable country around the world with a universal public health insurance system provides universal coverage of medicines. And that's what Pharmacare would be for Canada.
When we go to the doctor, when we have an emergency and go to the hospital, we don't have to think, oh my God, can I afford that? Instead, we show our BC Care card and we get some of the best care in the world. It should be the same way with our pharmaceuticals. When we need some medication, we shouldn't have to be thinking, gosh, can I afford that? But rather be able to show our healthcare card, perhaps pay a small deductible, and get the medications that'll keep us healthy.
Medications are very expensive. I mean, look what we just heard.
Medications can be very expensive, and very many Canadians, as many as 1 million Canadians, are foregoing other important expenses like heat or food or other medical care simply to pay for their prescription drugs. And what's really shameful, really, is that this wouldn't happen in any other country with a universal healthcare system. Only Canada and the United States have this kind of problem. And gosh, we wouldn't want to look to the United States as an example. We should be looking to Europe and Australia and New Zealand as the places that have these systems that give people prescription coverage, whether they're in the hospital or in the community.
And I think what's less well known is that this isn't just a problem for average Canadians. This is also a problem for seniors. We recently polled our members, and the numbers were astonishing. 14% of our members in BC said they had considerable or extreme distress, financial distress, paying for their medications, and another 33 said they had some financial strain. So that's almost 1 in 2 of our BC members struggling to pay for their medications. That's not right.
I have a short clip to show you on what Canadians pay for prescription medications. Take a look at this.
In 2016, Canadians spent $30 billion to fill more than 600 million prescriptions. That's more than 4 times what we spent on prescriptions 20 years ago. No other part of our healthcare system has increased in cost so quickly. Is that making your blood boil? Better take some deep breaths, because the cost of maintenance drugs, like those used to control high blood pressure, has gone up 58% since 2005. Meanwhile, specialty drugs have skyrocketed 325%. What's more, our costs here in Canada are going up faster than other countries. Between 2000 and 2012, our prices increased at a greater rate than any other comparator country. That's a tough pill to swallow.
The costs are rising, and what is our government doing about it? Recently, the Canadian government introduced a proposal to tackle Pharmacare. They're going to set up an advisory council with a report due in 2019, which is an election year. Wanda, do you think this is an insurmountable problem?
You know, it's really a question of political will. and I think this government has pledged to support the middle class, there is not only a compelling moral case for this, but also a really strong financial case. So would love to see this be on the political agenda for 2019.
Yeah, there's a lot of evidence that says when we don't have universal coverage, when people aren't able to access a public system easily, they fall through the cracks of the public and private system. There's a study that was done in Ontario that found that access to medicines for diabetics in Ontario was pretty good and outcomes were pretty decent if you were over 65, and that's because Ontario provides relatively comprehensive public coverage for those people. People under 65 in Ontario with diabetes had less access to medicines and more difficulties. And the authors of the study concluded that as many as 700 diabetic Ontarians die prematurely every year because they're not accessing the care that they need.
And you know, we talk about big dollars and savings of $4.2 billion and a pharmaceutical bill of $30 billion. I think it's sometimes helpful to look at an individual prescription. So there's a very popular drug many of our members are prescribed called Lipitor. And in Canada, depending on your coverage, the cheapest that you would get that drug for is something just over $800. In New Zealand, with a single payer plan, that drug is $15 for a year's coverage. So there are massive savings to be obtained, not to mention the moral imperative that nobody should be having to forego their medication.
This is a very hot topic in Canada right now. And let's hear what NDP leader Jagmeet Singh had to say about the Liberals' proposal, and then we'll be right back.
I would love to see this government implement Pharmacare because it would actually help people out. This government's not proposing that. This government's not even talking about a Pharmacare plan. They're talking about a study, and a study with no financing beside it. That's nothing.
Carpe Diem. Seizing the day for Canadians as we age.
Welcome back. Today we're discussing Pharmacare. I want to ask the panel for their thoughts on Jagmeet Singh's comments, but first, let's see the announcement that he was reacting to.
1 in 10 Canadians cannot afford the prescription drugs that they need. And every year, over 1 million Canadians are forced to give up food and heat in order to afford their medicines. To address this, we've created an advisory council on the implementation of National Pharmacare, to be headed by Dr. Eric Hoskins.
Wanda, what's CARP's position on Morneau? Do you think the Liberals are serious?
Carmen, I so hope that they are. When I was in Ottawa and I heard this announcement, it actually brought tears to my eyes. I thought, oh my goodness, this is going to do so much good for so many people. I know we've recently polled our members. 87% of them are in support of the concept that all Canadians should have access to the drugs that they need.
And this is a really big moment in Canadian history in some sense, certainly in the history of our Medicare program. We've heard commissions calling for Medicare to include prescription drug coverage all the way back to the 1940s. There's been a variety of political reasons why it hasn't happened, but this sounded like a government that said it's time. It's time that we move forward on this. And they've appointed probably the perfect chair for this role. This is a practicing physician who was recently the Minister of Health for the largest province and had actually rallied the provinces and territories behind the idea that Canada finally does need this universal public pharmacare program. So all of the indications were really positive, and we really hope that the Prime Minister is going to give Eric Hoskins and his council the freedom to do the right thing, to bring parties together, the provinces, territories, employers and unions, Indigenous Canadians, to come up with a path toward that goal that we've talked about for nearly 70 years.
Because make no mistake, we need a lot of political will to do this, because there are opponents and there are arguments against it, and maybe we should explore some of those. I mean, one of the things that I've heard is the risks to Canadians of a national pharmacare plan could be that they'll end up not getting access to their medications. Maybe they have a rare disease, or maybe there's a generic that is often prescribed that doesn't work for them.
Yeah, what's interesting though is if you look at international examples of countries that do this, they all actually provide better access than Canadians have. They all pay less money. So it's not just clinically the right thing to do, not just morally the right thing to do. It turns out to be economically the right thing to do as well.
What do you think is keeping something that seems so financially and morally to be such a good idea, what do you think is keeping it from happening?
Well, it's a great question. There's a couple of reasons we think. One of them is that we live in a complex federation, and we have to have federal and provincial governments at least reasonably consistent in terms of their vision of where to go. Right now, we seem to have that, whereas in the past eras where this has been talked about, you've had liberal governments at the federal level. In fact, at every major moment in pharmacare development in the past, it's been a liberal federal government. But you've had conservative Ontario, a separatist Quebec, and conservative Alberta and British Columbia. So lots of disagreement at that table. Right now, it's a different situation. We have a liberal federal government, liberal Ontario, liberal Quebec, and progressive governments in BC and Alberta.
I'm sure that you were both shocked, dismayed, surprised by what happened next. Let's take a look at what Mr. Morneau had to say the very next day after his speech on the Hill.
You said a national pharmacare strategy, not a national pharmacare plan. Those are two very different things.
Yeah.
We recognize that we need a strategy to deal with the fact that not everyone has access, and we need to do it in a way that's responsible, that deals with the gaps, but doesn't throw out the system that we currently have.
Strategy, plan, keep the current system. Wanda, you were there. How did you feel when you heard this?
I was gutted when I heard this. As happy as I had been, as almost on the verge of tears as I'd been to hear the announcement, then to hear him so quickly walk it back. I mean, we have over 100 different pharmacare plans in this country right now. We have a patchwork system. We have some catastrophic job coverage. It is not a system that we should be trying to keep together. Yes, we want to make sure that nobody falls through the cracks, but if we're going to do that economically in a sensible way, then a universal pharmacare plan is so clearly the way to go.
So what happened? Why did he say not so fast?
There's a number of stakeholders in our system that benefit from the patchwork system. It's not just the private insurers that get to sell the insurance, but it's also the manufacturers of the medicines that get to charge higher prices in Canada than they charge anywhere else, which we would compare ourselves to. And, it turns out that even pharmacies are worried that if we bring prices down, then their margins on pharmaceuticals go down. So there's a variety of actors that are opposed to change.
There's one concern that I do hear from our members, and maybe you can address this, is the idea of choice. When it comes to our school system, for example, we do have publicly funded schools, but many people choose to pay for and send their children to private schools.
Yeah.
And the concern that I've heard is, look, if we have a mandatory, compulsory universal pharmacare plan, we're taking away people's choices and potentially taking away something that they think is better for them.
Yeah, absolutely. And I think that the evidence suggests, and recommendations from a number of commissions, including expert recommendations from networks of researchers I've been involved with, all say, look, have a public system for the medicines for which there's good quality scientific evidence that the drug is safe, effective, and represents value for money, but allow people to then use their own money if they want to buy insurance for extra coverage or pay out of pocket for a medicine that doesn't satisfy all of those tests. There's no problem. Do I think a lot of Canadians will end up wanting to do that? Probably not. And the reason is that when you're in hospital, you're in a system that provides universal public coverage of prescription drugs based on a formulary, using purchasing tools of competitive tendering for supply, all the things that we would do in the community. You don't go into the hospital and say, can I use a little extra money and buy a different drug than you're giving me here? Because generally speaking, the drugs provided in our hospitals are safe, effective, and they're the kinds of things Canadians need.
There's so much more to go on this subject, but we'll be right back with our final thoughts. But first, let's hear your thoughts on pharmacare.
There's a lot of people that need help with care. Like I have a son who has cancer. He's got to buy his pills.
What would you say if we had a government official right here, right now? What would you say to them?
I would ask them why we have to pay so much for our meds when the government has money to pay for those. I don't.
I'd try to get something cheaper probably and eat less so that I had money for the medication. Either that or you choose between kicking the bucket.
Carpe Diem. Seizing the day for Canadians as we age.
It's now time to ask for our panel's final thoughts on Pharmacare. Steve, you want to go first?
Sure, and following on some of those comments there, the point about government having money available to do this, it turns out we do. The Parliamentary Budget Officer has said that essentially Canadians are spending $4 billion a year more than we need for a universal pharmacare program. That would mean that Canadians don't have to make these sacrifices or go without the medicines they need. This could very well be a great moment in Canadian history, a great moment in the history of Canadian Medicare, if Trudeau gives Dr. Hoskins and his council the right to do the right thing. And will they do the right thing? I think it comes down to political will. And one way to make sure that they have the political will to do the right thing is to tell them that that's what you expect. Write to MPs, sign petitions, join organizations like CARP, get involved in the dialogue so that Canadians are showing the government that prescription drug coverage for all Canadians is long overdue, and a universal public program would be the one that Canadians support.
Wanda, final thoughts from you.
This is an issue whose time has come, and I really call on the government to make this change. And I call on our viewers too. If you are an older Canadian or somebody who cares about one or hope to be one day, then it is time for you to join CARP. We are an advocacy organization that is as strong as our membership numbers. We know our members vote. 98% of our members voted in the last federal election. You can join CARP, add your voice to ours, and help us work for critical programs like universal pharmacare, so that everyone in Canada has the right to age with dignity, no matter their pocketbook, no matter their postal code.
Thank you, Wanda, for your words of wisdom. And Steve, thank you so much for being with us on the panel today. And that's the show. Remember, as our CARP president Moses Neimer always says, the best way to keep going is to keep going. So stay zippy and seize your day.